Welcome to Fidelity Soundbites. I'm McLean, Portfolio Manager for the Fidelity Australian Opportunities Fund. And joining me today is Zara, Lyons, Analyst and Portfolio Manager, and Mowry, Analyst for the consumer sector. Today we're going to be analysing the 2023 budget and the implications for various sectors across the market. Labor delivered their second budget, and it was the first surplus Australia's seen in 15 years and the first one delivered by a Labor government in over 33 years. And it was a remarkable $41 billion turnaround from the deficit they forecast as early as October, and it was largely down to good luck. Historically, when Australia's produced surpluses, it's when the economy is running at full employment and there's a commodity boom. And luckily enough, last year we enjoyed both of these factors. But with inflation remaining stubbornly high, unemployment forecast to rise and commodity prices weakening, it's going to get much tougher in coming years. Brendan, the government was walking a balancing act here, trying to trade off the inflationary pressures with the cost of living pressure that the economy is facing. Did they achieve that with this budget?
Yeah, thanks, Casey. Look, given the precarious sort of macro environment that we are facing at the moment, I don't think we were ever really likely to see big, sweeping structural change and reform. The budget, sort of as you say, is about demonstrating fiscal restraint while simultaneously providing cost of living relief for those who are most under pressure. And we saw about $14 billion of relief measures being introduced that are specifically geared towards reducing the cost of living pressures, particularly for younger and lower income earners. And so I think the most interesting thing to analyse within this budget is the context of the competing interests of the RBA and the federal government. The RBA is, raising rates to crush demand, keep inflation under control, and the government is trying to keep its base happy and secure voters. And it's really difficult to achieve both of those things in unison. So I think, looking forward, the more enduring impact and ultimately what the market will care about is the impact of the $14 billion in relief measures on aggregate demand and ultimately inflation. If you're going to give a consumer $500 in a handout effectively to reduce their energy costs, that $500 is going to be found somewhere else. It's going to be redistributed somewhere else in the economy, keeping upward pressure on both demand and inflation. So ultimately, I'd argue that while this budget's incrementally positive for demand, it's equally likely to elicit an incrementally hawkish monetary response from the RBA. And that, I'd argue, sort of elevates the risk of reinflation and further tightening as we push further into the year.
Yeah, thanks, Brendan. I mean, to put some numbers around that, the $14 billion in handouts this time, that compares with $8.8 billion in cumulative stimulus payments during COVID, which I think were a key source of the inflationary pressure along with the supply side constraints that we saw. But there's going to be some clear winners out of this spending. Who do you think is going to benefit from this?
Look, the interesting point to note around fiscal stimulus, particularly when it's targeted at lower income individuals, is that because a higher proportion of their income is dedicated to fixed essentials, so groceries, education, healthcare, things like that, each incremental dollar of income has a higher marginal propensity to consume attached to it. So that means that we're likely to see a high transmission from savings or the cost of relief under these programs finding themselves redistributed back into the broader consumer economy. And, when you think about what these measures are targeted at, the younger and lower income demographics, the things I'd probably highlight as being the direct beneficiaries, the quick service restaurants, so your Domino's or, your KFC franchise operators, Collins Foods, restaurant brands, and then down into accessories and apparel retailers like your Levisa's, Best and Less, Universal Holdings, and even companies like Wesfarmers, through Kmart and Target.
Great, thanks. And Zara, healthcare was another key area of focus of the budget. Who were the key winners from the measures introduced?
Well, so the key winners were the aged care workers, the over 11 million consumers that access GP services and over 6 million patients that rely on medications for chronic disease management. So while the overall healthcare budget only increased 2% on PCP, the two big ticket items were aged care, which received a 20% bump in funding, and that was due to a 15% increase in aged care workers' wages, and which obviously has potential positive implications for Estia and Regis. And then on the Medicare side, Medicare received a bump of 6% to funding, which also was largely allocated to general practitioners. So specifically, GPs will see a tripling in the bulk bill incentive that they can provide consultations for vulnerable people, particularly children under 16 years of age and concession holders and pensioners. Moreover, there was an indexation boost of 3.6% for Medicare services, specifically for GP services and diagnostic imaging services, but not for pathology. And that may be a positive for Sonic Healthcare. But all of this was funded by a reduction in funding for prescriptions, which is actually going backwards by 7% in real terms over the forward estimates. So the government's actually expecting over 300 medicines will be cheaper for those 6 million people living with chronic stable diseases, who will now be able to buy 2 months' worth of medication with a single prescription, which reduces the amount of time they make trips to the pharmacy and trips to the GPs. But overall, pathology and private health insurance generally escaped any major changes, either positive or negative, from the budget.
And do you think many of these GPs, many of who've just introduced copay models, will they switch back to bulk billing?
While a tripling of bulk bill rates is a good start, I'm sceptical that it will arrest declining rates of bulk billing. We've seen bulk billing rates continue to decline from around 88% down to below 85% in recent times. Moreover, it's really difficult to actually find a GP that will bulk bill you when there's only 35% of clinics that do bulk bill nationally. So declining rates of bulk billing, increased out-of-pocket costs and broader cost of living pressures mean that many patients delay going to the GP and ultimately end up in emergency departments looking for treatment, which then adds more pressure to the hospital system.
And the wage increases for aged care workers, which was sorely needed and well-deserved, is that going to have any broader implications across the sector?
The aged care sector wage rise will offer cost of living relief for about 205,000 aged care workers, and these have been the most poorly paid nurses in the system. And it's certainly the largest ever pay increase in the history of the Fair Work Act, so it's quite meaningful. So you're right, the key question is whether or not you see a recalibration of wages across the nursing and healthcare worker spectrum and more broadly the healthcare sector, and I suspect it will be inflationary in the years to come for the sector.
Great. Another key forecast of the budget was for unemployment to rise to 4.25% by June next year. Zara, do you think this is going to lead to any concerns around mortgage delinquencies?
Certainly rising unemployment does make it harder, obviously, for people to repay their mortgages. According to the RBA, though, mortgagors historically have been 40% less likely than non-mortgagors to lose their job. So that's a silver lining if there was one. But if we do assume that the change in unemployment was evenly split between those that the third of the population that are renters, the third of the population that are mortgages, and the third of the population that own their own home outright, then essentially only 25 basis points of that delta to impact the mortgage sector. I'd say that the banks have healthy provisions, and under their social licence to operate, they really do need to provide hardship services to assist those in need. And pulling the home from them is, a last resort in most cases. Certainly, loan value ratios are fairly healthy across the sector, and offset and cash buffers are generally high across the sector at the moment. But whether or not higher interest rates persist for longer and that erodes those buffers quite quickly in the case of unemployment remains to be seen. But at this stage, I don't think there's cause for alarm.
Great. So the budget definitely focused on the expenditure side of the ledger. But to me, it left a lot of unanswered questions, with the big ones being how the government's going to fund these huge spending bills that they have coming in defence or NDIS, which is going to need some form of tax reform in the future, whether it's around capital gains or dividend imputation or even GST reform, which brings forward the risk that they're going to be raising taxes when the economy is slowing in future periods. So I think there's a lot of issues that the government needs to address in future budgets as we enter a slowdown in the Australian economy. So that's a wrap for today's episode. And if you enjoyed it, please subscribe to Fidelity Soundbites, and we'll see you next time.
Some important information on today's podcast. This podcast is issued by Phil Responsible Entity Australia Limited, AFSL number 409340. This podcast is intended as general information only and has been prepared without taking into account any person's objectives, financial situation, or needs. You should consider the product disclosure statement and target market determinations for Fidelity Australian products at fidelity.com.au. Please click the link in the show's description to read the full disclaimer.